A midlife crisis is more than just a cultural stereotype. It's a real psychological struggle that can surface between the ages of 40 and 60. Often triggered by aging, loss, or unmet expectations, it can actually lead individuals to question their identity, make impulsive choices, or abruptly abandon long term commitments. While not officially classified yet as a mental illness, the emotional and relational fallout is very real, especially for the spouses and families left behind. This podcast gives voice to those living through the aftermath, exposing the hidden pain, and seeking accountability, healing, and understanding. Thank you for joining us today on MLC Bomb Drop and Beyond. The stories and events discussed in this podcast are for informational and entertainment purposes only and should not be considered legal, medical, or professional advice. Any names, locations, or identifying details have been changed to protect privacy. Any similarities to actual persons, living or dead, or real events are purely coincidental. The information presented on this podcast is for informational purposes only and should not be considered as professional advice. Always consult with a qualified expert regarding any decisions related to your specific situation. The views expressed by guests are their own and do not necessarily reflect the opinions of the host or the podcast creators. Hey guys, midlife crisis is a popular psychological construct. It's not a formal diagnostic category. And it's simply what we refer to because we have no other term, and that's what everybody seems to go to is just midlife crisis. However, some academic reviewers argue that what we call a midlife crisis is actually a disorder known as, or a subset rather, of adjustment disorder, which is in the DSM. So, adjustment disorder, or AD, is a recognized mental health condition in the DSM-5 TR and earlier DSM editions. It describes emotional or behavioral symptoms that arise in response to a specific stressor or life change. And the response that somebody has is going to be more intense than normal coping reactions, but not severe enough to qualify as a major depressive episode or other disorder. So to meet the criteria, these are the key points that must be present for a diagnosis of adjustment disorder. First, there is an identifiable stressor. It's like a clear trigger, such as a divorce, job loss, illness, relocation, retirement, infidelity, or any major life transition that, boom, that's the trigger. Number 2 would be the time frame, symptoms beginning within 3 months of the stressor's onset and typically resolving within 6 months after the stressor ends. Third symptom would be emotional or behavioral, such as depression, sadness, tearfulness, anxiety, nervousness, worry, anger, irritability, acting out, social withdrawal, poor concentration or sleep, reckless or impulsive behavior. The response must be out of proportion to what would normally be expected and must cause significant distress or functional impairment, such as impairment to their work, relationships, or daily life. And then finally, they exclude other disorders. So the symptoms, they don't want the symptoms to fit under another diagnosis such as major depression, PTSD, or anxiety disorder. So if you've got those 5 little symptoms there, then it could be adjustment disorder. And at least that's a good start. So if you were going into the doctor's office, if you thought you're having a midlife crisis symptoms or your spouse or partner is, my suggestion, having gone through this, I would say, ask for a blood panel to start so they could check your hormone levels and mention attachment disorder and see where it goes from there. Because when we say midlife crisis, a lot of times we get the eye roll and we don't get treated. We just get, pushed under the rug. They don't know what to do because there is no path. However, by saying you've got adjustment disorder, at least then you might have a path to something forward. I think it's all about finding a path. Clinicians can specify which patterns fit best: depressed mood, anxiety, mixed anxiety and depressed mood, disturbance of conduct such as acting out and aggression, mixed disturbance of emotions and conduct. Those are all things that can really help the clinicians in their diagnosis and treatment for you guys. And many people experiencing what's called a midlife crisis, like intense distress, impulsive decisions, loss of identity, relationship upheaval, reckless behavior. These would all meet criteria for adjustment disorder in psychiatric terms. For example, the trigger might be aging, marital conflict, affair, loss of career purpose, or an existential fear. The symptoms might include anxiety, depression, erratic spending or affairs, personality changes, or withdrawal. And the duration can fluctuate with ongoing stressors like divorce or regret. So, clinicians often conceptualize midlife crisis as a form of adjustment disorder, a reaction to midlife stress and loss rather than a unique psychiatric illness. And because adjustment disorder already exists and can encompass almost everything seen in midlife crisis, the APA has little incentive to add a new category in their framework. Midlife crisis is a cultural shorthand for a cluster of adjustment disorders that occur during midlife transitions. Okay, guys, so how does someone actually get diagnosed with adjustment disorder? Well, they identify the trigger, they look at the timing, they look at the symptoms, and they rule out the other conditions such as major depression, PTSD, or bipolar. So they can start with adjustment disorder and go from there. And it's all about getting a start. Once you're on the road, um, I'll call it the road to recovery, but you're not going to get on that road if you don't have, pretty much if you don't have a DSM checklist. But for what a lot of us call midlife crisis behavior, it fits right inside this diagnosis, especially in the early stages. So think about it. A 40 or 50 something year old suddenly panics about time, aging, purpose, or regret. They start saying things like, I've wasted my life, or I need to find myself. They start to act out by having an affair, changing their career, a total identity flip. Clinically, that can be framed as adjustment disorder with mixed disturbance of emotions and conduct. But here's the deal. The DSM says these symptoms should resolve within 6 months once the stressor ends. And anyone who's been through an MLC knows this can last for many years. That's why adjustment disorder, as it is, doesn't really capture the full reality. It's like calling a tornado a gust of wind. But the good news is there is a path that we can work with. Adjustment disorder is treatable, but it takes insight, honesty, and willingness, which most midlife crisis spouses don't have yet. Some of the treatment could be psychotherapy talk, like talk therapy, CBT. It helps people challenge distorted thinking and develop healthier coping skills. Sometimes EMDR or trauma-informed therapy is used if the trigger involved betrayal or loss. Then there's supportive counseling, learning to rebuild structure, reconnect socially, and handle stress without escape mechanisms such as alcohol, sex, or overspending. And that's crucial. And medication if needed. Short-term antidepressants or anti-anxiety meds may be prescribed if symptoms overlap with depression or panic. But medication alone doesn't fix the cause, as we know. It just steadies the emotional freefall. But that's huge for somebody who's in a freefall, just something to temporarily help them steady the ship. With treatment, symptoms usually improve within 6 months. Without treatment, the person often projects their pain outward, blaming the marriage, blaming the spouse, or needing freedom instead of facing the real internal crisis. And that is when you see the full MLC spiral begin. And here's the part that drives so many of us absolutely crazy. If your spouse is in an emotional chaos and has been diagnosed with adjustment disorder, the legal system will still consider them competent. They can file for divorce, sign contracts, move money, make parenting decisions, because adjustment disorder doesn't meet the threshold for legal incapacity. Courts view it as a temporary distress, not a loss of reasoning ability. Unless someone is actually psychotic, delusional, or has dementia, unless that, they're still seen as capable adults making choices. Even if they're destructive ones, the courts still allow it. And that's the gap between mental health reality and legal reality. It's why so many of us watch helplessly while the system just treats a mental breakdown like personal growth and voluntary behavior. They don't get it. And for the folks out there that do get help, real healing is possible. Adjustment disorder can be a total wake-up call, not a death sentence. It can lead to self-reflection, accountability, and eventual reintegration if the person chooses truth over escape. But when left untreated, adjustment disorder festers into long-term identity confusion, depression, and sometimes personality collapse. And that is what we recognize as the tunnel of MLC. That's why awareness matters. If therapists, courts, and families could see this diagnosis as an early warning light instead of a footnote, lives and families could be spared enormous pain. In psychology, acute means sudden onset, and that symptoms appear fast and hit hard. And that's exactly what the bomb drop is. And what it looks like: anxiety, panic, rage or despair, insomnia, intrusive thoughts, identity confusion, impulsive behavior. At this point, the person is still reachable. They're in a state of panic, not psychosis, not yet. A skilled therapist could help them stabilize if they were willing to seek help. And I remember seeing this firsthand. I remember somebody reaching out desperately, taking time off work he wanted to talk to priest because he knew that something was wrong in his head, trying to find the right therapist. And that is huge because people, as they're starting in this acute stage, they literally feel something's not right. They're still aware and conscious that something's happening inside them, but they don't know what to do. And this is where, if you can help get somebody into the right type of therapist at that moment, you can really help prevent them getting into the tunnel. However, without treatment, they're going to most often go right into the acute stage, becomes what we call chronic, and that is the long-term tunnel. After the bomb drops, this person doesn't come back to their senses. They descend just further into the tunnel, just gone, completely gone. And this is where the chronic form takes hold. They detach emotionally, they lose empathy, and they start to live in an alternate narrative, and one that justifies their destruction. And this can last years, sometimes 5, 10, or more. Emotional numbness, flat affect, cycles of euphoria, guilt, depression, addiction to escape mechanisms such as the affair, alcohol, drugs, fantasy life. Rewriting of history to reduce cognitive dissonance, personality changes that mimic narcissistic traits. Clinically, it is no longer acute adjustment disorder. It has now become chronic adjustment disorder with mixed disturbance of emotions and conduct. And if it continues long enough, it can mimic full personality decompensation, a collapse of moral reasoning and self-identity. That should be devastating to everybody, that just to think that you can avoid that. If we reframe MLC as a mental health progression, not a random midlife whim, then we can push for early intervention during the acute stage, advocate for legal reforms, recognizing the impaired judgment during crisis, reduce the stigma for the person suffering and for the spouse being destroyed. This is not a choice, you guys. This is a collapse. It's a preventable one. If anyone has seen it for what it is, and I know you guys have seen it because you're listening to this podcast today. Remember, this tragedy, the acute phase, is treatable. The chronic phase, only reversible when the person hits that wall of reality. And that wall of reality can be devastating because it can lead to self-harm, and that's what we want to prevent. So seriously, if mental health professionals recognize MLC as an acute to chronic stress disorder, families could intervene early. Marriages could be saved, children could be protected, and maybe the person in crisis could recover before they lose everything. Once you name it correctly, you can fight it correctly. So seriously, start asking about adjustment disorder. We've been calling it midlife crisis for decades, but clinically, what you're witnessing is an acute adjustment disorder that becomes chronic when ignored. They say adjustment disorder causes emotional dysregulation, impaired judgment, and maladaptive coping. Somebody who's diagnosed with adjustment disorder will overreact to perceived threats or criticism, misinterpret reality through the lens of stress or fear, seek control when their world feels out of control. And I think that's what a lot of us see in the early stages. and throughout the stages of the tunnel is that paranoia, overreaction, things like that. And we pay the price because we're the ones accused of ridiculous things. And it's only because their perception is so skewed. They believe distorted narratives or feel justified in extreme actions, even because their perceptions are totally irrational. They're not necessarily faking in a cold, calculated sense. They're actually reacting from panic, shame, projection, and that can absolutely lead to false or exaggerated accusations. And I've saw that happen first in myself, in my case, in court with ridiculous allegations that were thrown out, but still, it's devastating to be accused of stuff that you haven't done. It's ridiculous. And now we know it's not like that person did that out of spite um, or to they did it because they seriously are in such a different mental state. And if left untreated, adjustment disorder can progress into chronic maladaptive behavior, especially when it overlaps with the things we see, such as narcissistic, borderline personality, histrionic personality disorders, substance use, alcohol and drugs. This makes it way worse. And especially if they have external influence, like an affair partner or an attorney or enabler, encouraging them to protect themselves, it can really spiral out of control. And of course, there's a trauma defense they have. They project guilt or fear outward. And that's where, again, false reports, TROs, even perjury can appear in court. And that's not from evil intent, but from seriously a psychological collapse where their self-preservation overrides all integrity that they ever had. It's not the adjustment disorder causing the lie, it's the fight or flight psychology inside it that justifies deceit to maintain control. And I see this every day in the people I talk to. And in midlife crisis scenarios, the person is often emotionally flooded and totally unable to self-regulate. They're influenced by the affair partner or outside party that's feeding them new narratives. They're ashamed of their own actions and they need a scapegoat. And they're totally terrified of losing face, reputation, or control. Filing a false report or restraining order gives them a sense of protection or power. It's like a psychological displacement. If I can make you the villain, then I don't have to face what I've become. And this aligns less with adjustment disorder itself and more with moral regression under stress, which is common when acute adjustment reactions go untreated and evolve into chronic personality-driven behavior. And that, again, is why it's so important that clinicians, lawyers, judges understand how this works so they can see the truth behind all these, behind this behavior. It's ridiculous. And you guys, remember, it's still considered intentional misconduct. Courts don't excuse perjury or false reports, even if a mental health episode is involved. It's sad. Seriously, adjustment disorder doesn't make someone evil. It makes them unstable. And in that fog, truth gets bent to fit emotion. False claims, restraining orders, and sudden accusations are often desperate attempts to regain control. They're not deliberate criminal plots, but psychological self-protection gone wrong. And if you happen to be going through a divorce or court case with your spouse or partner that's in MLC, some tips you might want to use. And this is not legal advice. These are just tips in case you're going through this. First, look for a family law attorney familiar with coercive control or high conflict personalities. Ask them to help you file a written, factual declaration instead of reactive statements. And be sure to use the mental health context pretty carefully. If there's documentation of your spouse's adjustment disorder, your attorney can then reference it as context, not an attack. They can say something like, there's evidence of emotional dysregulation consistent with adjustment disorder during this time. Remember, the court process is slow, but truth documented consistently tends to surface. And every manipulative act reveals the disorder more clearly. Remember, you guys, midlife crisis isn't a lifestyle choice. It's often an untreated, acute adjustment disorder that explodes into a life crisis. If your person got clinical help at the panic stage, the bomb might never drop. So my next question is, hey, if MLC or like if an MLCer falls under the DSM category of adjustment disorder, what might a person willing to be a homewrecker, what might they fall under? Well, if we assume the MLC criteria is consistent with adjustment disorder, meaning they're reacting maladaptively to a major life stressor, then the affair partner, the homewrecker, can often be understood through a different but complementary psychological lens. And here are some of the most fitting diagnostic or personality categories that might apply, depending on the person's traits and motivations. Dependent personality traits or disorder could be pervasive and excessive need to be taken care of, leading to a submissive and clinging type behavior with fears of separation. The affair partner often seeks emotional security and validation from a person who's already taken or, married, because the attachment feels pre-secured. The MLCer's stability, family life, and professional status represents safety. And that affair partner would feel things like, he or she makes me feel seen again. I finally feel chosen, which reflects an unmet dependency need. Then there's a histrionic or narcissistic personality traits. Features include craving attention, admiration, or a sense of superiority, deriving identity from romantic or sexual conquest. For some affair partners, the affair becomes a performance of desirability, a fantasy of winning over the spouse. I actually had my ex's affair partner use the term winning, which I thought was so strange. Anyway, there's often a competitive drive toward the legitimate partner and a need to be idolized, mirroring the MLCer's own narcissistic fragility. They might unconsciously collude in the delusion that this is true love rather than mutual escapism, because that's what it is. There's trauma bonding or unresolved attachment wounds. Core feature of that is reenacting early trauma dynamics through adult relationships that replicate instability or rescue fantasies. And that's many homewreckers are not predators so much as totally wounded people looking for rescue or intensity. And I remember hearing that myself. Oh, I need to rescue her. It's like, oh my gosh. Yeah, many homewreckers are not predators. They're really wounded people looking for rescue or intensity. The MLCer's chaos feels familiar to them. The highs and lows mimic earlier attachment trauma. They may experience obsession and fear of abandonment if the MLCer wavers, keeping them locked in the triangle. There's big-time codependency or the rescue symptom, the compulsion to fix, save, or nurture someone broken. The affair partner sees the MLCer's pain as something that he or she can heal, giving him or her a false sense of purpose. And this aligns with the wounded healer archetype, or what clinicians sometimes call pathological altruism. That result is that he or she enables destructive behavior under the guise of love or empathy. Crazy. There's fantasy-driven or identity-seeking behavior. Core feature of that is the fragile self-concept, seeking validation through being desired or chosen. The affair functions as an identity project. Like he or she is the one who awakened him and brought him to his or her true self. It's less about the person and more about what the relationship symbolizes, such as youth, desirability, control, rebellion. Yeah. In short, if the MLCer's crisis can be conceptualized as an adjustment disorder rooted in an identity collapse, then the homewrecker's behavior often reflects personality structure and attachment pathology, most commonly known as dependent, histrionic, codependent, or narcissistic patterns. The two are drawn to each other because their dysfunctions fit together like puzzle pieces. The MLCer needs adoration and escape. The AP needs validation and purpose. It's a short-term emotional symbiosis that often implodes once the fantasy collides with reality. So if that affair partner has like borderline personality disorder, they're going to exhibit an intense fear of abandonment, emotional instability, and a desperate drive for connection. Sexual behavior will be impulsive and often used as a regulation tool. Sex becomes a way to feel momentarily attached, valued, or soothed. And partners with BPD may idolize someone quickly, engage sexually fast, and then swing into devaluation or rage when the fantasy cracks. Affairs can feel intoxicating, forbidden, validating, and chaotic, all emotional peaks that mirror the BPD cycle itself. But the long-term pattern is many repeat the cycle. The BPDs go from affair to affair, intensity to intensity, until the fantasy breaks or they crash emotionally. NPD, narcissistic personality disorder, more grandiose, need for admiration, entitlement, and lack of empathy. Their sexual behavior is used to control, to conquer, or affirm superiority. The affair partner may feel powerful winning someone who has committed to them. It feeds their ego. They may engage in multiple affairs or serial seductions to maintain that supply. And the dynamic with their MLCer is the perfect storm. The MLCer needs validation. That narcissistic AP needs admiration. It's a supply exchange, not love. And then there's the histrionic or attention-seeking traits. That affair person has an emotional shallowness, has lots of drama going on, craving for attention and excitement. Their sexual behavior is more flirtatious, seductive, or performative. Sexuality becomes a stage. They thrive on being desired, even by unavailable men, because it amplifies their perceived worth. And once attention fades, they seek a new audience. Then we have the trauma-based or attachment-seeking patterns from unresolved childhood trauma or neglect, and that leads to adult attachment anxiety. Sexual behavior for the trauma-based person is going to be high risk or permissive sexuality becomes a form of self-medication. It mimics intimacy and temporarily soothes their emptiness. And these individuals may genuinely crave love, but seek it in unsafe or unavailable places. Often they feel used, discarded, or replaced, repeating their original wound from childhood. Yeah, many affair partners in MLC dynamics display sexually impulsive or permissive behavior, but not always out of lust or moral failure. It's often rooted in emotional dysregulation, identity voids, and attachment wounds. And when BPD or MPD traits are present, the pattern is rarely one and done. They move from affair to affair, addicted to the rush, terrified of the void, and often convincing themselves each time that, oh, this one's real, this one's my soulmate. So yeah, the person in MLC with the adjustment disorder, they detonate their life, their marriage, and their family. But what about the person on the other side of the fuse? The person who willingly joins that explosion? When someone in midlife crisis spirals into what we now see as adjustment disorder, a mental break tied to loss of identity, purpose, or aging, they don't attract healthy partners. They attract mirrors. And often those mirrors come in the form of people who are emotionally hungry, validation starved, and thrill seeking. The affair partner steps in and says, I see you, I get you, I'll save you. But what's really happening is two broken egos colliding. One running from himself, the other trying to find herself through him. Many affair partners show patterns that align with deeper personality disorders, not temporary reactions, but enduring traits. There's the borderline personality disorder, commonly hooked up with an MLCer. This brings the roller coaster of fear of abandonment, emotional highs and lows, and a desperate need to feel connected, even if that connection destroys someone else's home. They rush intimacy. They confuse chaos with passion, and they use sex to anchor themselves when they're emotionally spinning. And once the fantasy fades, the same intensity that pulled them in often flips into anger, blame, or another escape into a new affair. Then we have narcissistic personality disorder. On the other hand, they play the game differently. It's not about connection. It's about conquest. The narcissistic affair partner sees someone else's husband or wife as a prize to be won, proof of their superiority, their desirability, their power. And once the novelty fades, they're already scanning for the next supply, the next hit of admiration. Both types share a deep emptiness. One tries to fill it through chaos, the other through control. There's sexual risk and the illusion of power. Many affair partners, especially those with BPD, MPD, or histrionic traits, are sexually permissive or impulsive. And that's not because they're liberated, but because they're lonely. Sex becomes a way to feel valuable, visible, chosen, even if only for a moment. For the borderline AP, sex is a survival mechanism. They think, if I'm desirable, I won't be abandoned. For the narcissistic or histrionic type, it's about performance. If I'm desired, I'm superior. And for the codependent rescuer, it's really, if I give him everything, maybe he'll stay. But beneath all that, it's not love. Beneath all that, it's fear. Fear of being ordinary, fear of being unseen, and most of all, fear of being alone. And that fear fuels risk, unprotected sex, rapid attachment, emotional obsession, all of it masquerading as intimacy when really it's self-destruction dressed up as love. And once that rush fades, the affair partner often repeats the cycle. The pattern becomes predictable. New affair, new soulmate, new fantasy. New affair, new soulmate, new fantasy. And each time they're chasing the same dopamine hit that temporarily erases their own emptiness. They rarely heal between relationships because the affair itself becomes the drug. And when paired with someone in midlife crisis, another person chasing emotional anesthesia, the result is a mutual addiction. It feels like destiny, but it's really just two lost souls feeding each other's dysfunction. So yeah, while a midlife crisis individual may fall under adjustment disorder, the affair partner often reflects deeper personality pathology, borderline, narcissistic, histrionic, or codependent traits. Both are unstable, both are using each other, and both are chasing validation that they can only find within themselves. It's not passion, you guys. It's not true love. It's not soulmates. It's pathology. And it's why these relationships almost always burn out in the same smoke they started in. So thanks for joining me today, you guys. Until next time, stay grounded. And remember, awareness is your armor. Stay strong. Rise up. And you guys, forward moving spouses, you are not alone. Left behind spouses, you are not alone. Those in crisis, you are certainly not alone. This is just crazy how epidemic this has become. I have a waiting list now of people from around the world that I'm trying to get to. And if you've been through a midlife crisis or been impacted by someone else's and you want to share your story, I'd love to hear from you. Hang in there, you guys. I will get to all of you. Please reach out to me at mlcbombdrop@gmail.com and visit us on Facebook and Instagram, MLC Bomb Drop. And just remember, your voice matters. Your story could be the one that helps someone else feel seen. It could help someone else feel heard. And you know, it will help somebody else feel understood. You are not alone, no matter where you are in your journey. If the bomb was just dropped, the earthquake just happened, if you are 7 or 8 years in and you're coming out of starting to wake up and awaken to this, um, you are not alone. It's sad that this is epidemic, but we're here to provide support. So until next time, take care and live authentically each and every day. Thanks again, you guys.